Interprofessional collaboration in education and practice. Background motivation and international guidelines. In the first presentation of this module, you were introduced to breast cancer care and treatment pathway. Please keep the pathway in mind while following the next 3 presentations. Why is there a need for interprofessional collaboration within health and social care? Increased knowledge and expertise, increased specialization, along with technological development, has made it possible to solve challenges we could not even dream about only a decade ago. This development has also resulted in an increase in fragmented healthcare services, as well as an increasing number of persons, professions, and specialized departments involved in care and treatment. These aspects give rise to the demand for interprofessional collaboration. 2 issues are particularly important to reflect upon when contributing to an interprofessional collaboration, as well as to the outcome of an interprofessional team. What is the scope of your professional knowledge and experience within interprofessional work? Why is it important for you to collaborate with others? Have you found yourself in situations in which you sense that your own knowledge is not sufficient and that the expertise of others may be better suited or needed as a supplement in solving the challenges? If so, who or which professions do you regard as relevant supplements to your own competence? It may also be wise to consider your own experience with collaborations in both your private and work life. In these interactions, what has made you feel heard? And what made you want to know more about the perspective of the other participants in the collaboration? Before we proceed, please take a few minutes to write some keywords about why you enrolled in this course. Establishing an interprofessional mindset. What was your motivation for enrolling in this course? Did you enroll in this course to become a more competent team worker? Or did you enroll to become a better nurse, biomedical laboratory scientist, radiographer, or radiation therapist? How do you believe these 2 issues are connected? It is not unusual to focus primarily on the uniprofessional segment of educational programs or courses. But to become a highly competent professional, you also need to focus on the system, the organization you work within, and on the processes taking place between professions and different departments. The term interprofessional competences focuses on professionalism as something broader than your specialized field. It includes the understanding that health and social work is a collaboration between several experts and within different departments or levels in the healthcare organization. How do you think interprofessional competences can make you a better professional? Please write down a few keywords. The World Health Organization, WHO, and its partners recognize interprofessional collaboration in education and practice as an innovative strategy that will play an important role in mitigating the global health workforce crises. Do we waste resources when we do not manage to work together sufficiently? And when we fail to utilize the competences of others equally well as our own competences? WHO also focuses on what they describe as complementary competences, when 2 or more individuals from different backgrounds with complementary skills interact to create a shared understanding that none had previously possessed or could have come to on their own. In addition to the individual performing their own role and attending to their specific professional task, complementary competences also encompass working together, sharing knowledge and perspectives, and listening to each other. And through this collaboration, we may uncover suggestions and solutions that none of us could have foreseen on our own. The lack of collaboration in health institutions and between departments and different levels can be challenging. According to WHO, interprofessional education, IPE, is a necessary step in attaining a better collaboration. And WHO's, as well as the internationally adopted definition of IPE, is IPE occurs when students from two or more professions learn about, from, and with each other to enable effective collaboration and improve health outcomes. In order to teach and learn interprofessional competences, we need to know what interprofessional competence is. This will be the subject for the next presentation. Here are the references and the author. This presentation has been produced in a cooperation with EBreast 2 project, co-funded by the Erasmus Plus program of the European Union and these organizations.